Hello and welcome to Your Health Matters on Sun 20 TV. I'm Shari Einhorn. Thanks so much for joining us. We have a great guest to start off with. We have Laura Borghardt, Director of Cancer Services at the Phillips Family Cancer Center and the Ellen Hermanson Breast Center at Stony Brook, Southampton Hospital. Can you tell us a little bit about your role at the centers? What do you do and when will people see you there?
So I started actually back in cancer care and radiation oncology at Stony Brook about 20 years ago. And we started this project of the Phillips Family Cancer Center back in 2014. It became such a labor of love that I actually started here when we first opened up. I oversee the operations of both the Phillips Family Cancer Center and recently the Ellen Hermanson Foundation Breast Center. And it's just been absolutely amazing. I'm there every single day, Monday through Friday. I spend half my day at the cancer center, half my day at the breast center. And it's just been an amazing experience for me.
Now, you come at it from two different points of view, right? Because you're an administrator, but you are also, I'm told, a cancer survivor. Can you share some of that experience?
Yeah, it was a really interesting, strange, but wonderful thing that happened. I had no sooner started at the cancer center, and 4 months later I was diagnosed with breast cancer. But it was just absolutely amazing because it was really, putting my money where my mouth is, right? I was literally and figuratively putting my life in the hands of this program that I had created and the people that I'd hired. And it was just absolutely extraordinary. It wasn't just a team that we had built, it was really an army. And it was something that I got to see what the patient experience was. And from there, I was able to take those things and create the best possible patient experience for the people that are coming into my cancer center.
Lots of folks don't have that flip side to work off of, so you see that as a benefit, I'm guessing?
Without a doubt. I knew what worked, I knew what to focus on, and because of my position as an administrator, I was able to put those things into actions and create a really wonderful environment for the patients that come to the cancer center.
When did the center open, just to verify, and what treatments specifically are offered there?
So we actually opened our doors in 2019 with radiation oncology, and about 6 months later we were able to open up for medical oncology. So we do both medical oncology and radiation oncology, which is phenomenal, especially out east. There was such a need for it because the closest one I think was out in Riverhead, so it was really quite a hike for patients. So we do have a radiation oncologist there every single day to do the standard radiation oncology treatments. Mm-hmm. So we do photons and electrons. We do the complicated stereotactic radiation surgery as well as radiation therapy. And then we have a medical oncology upstairs that is not only a medical oncologist, but she's a hematologist. Oh. So we do both the infusions, the injections, and the transfusions for patients. So it's a really full service, state-of-the-art facility.
And what's the capacity there? And is it inpatient, outpatient, both?
It's outpatient. Okay. So we're right around the corner from the hospital. So we have a 14-bay area upstairs for the infusions, and we have a linear accelerator downstairs for radiation oncology. So we've really been doing great with being able to take care of the patients within the community. And
what's the reaction from the community? I mean, lots of folks really love to have, local connections to their medical personnel.
Absolutely, it's been phenomenal. I've always kind of realized from the very beginning within this community out here that you're not just treating the patient, you're really treating the entire community. It's so tight-knit, and the word of mouth is so important because if they have a good experience, they're going to share it. So it's been great to work with not only the patients, but you guys have a lot of not-for-profits in the area and within the community, and they've been just absolutely warm, opening up their arms to us because they see the need, they see that what we're doing there and the importance, and it's just been absolutely great, and the patients are really happy.
You mentioned close-knit community. The summer on the East End is like a whole different ballgame, right? Mm-hmm. There are lots of folks who are out here who have friends and family come visit or come stay who may be treated somewhere else for cancer. Are they able to transfer care, and can you walk us through that process?
Yeah, absolutely. It was always a very interesting setup because you did have so many people that spent certain times in the city and then came out here for their homes. And if you're coming out here and you still want to keep that doctor in the city, it's not easy, right? So our medical oncologist, Dr. Yarvikova, immediately understood the need. And so she was very, very willing to work with whatever physicians there were, whether they're in the city or even some of those snowbirds that go down south, and to kind of work with them about what their regimens were. She would see the patients. She would work with the referring physician, and then she would be able to treat them based on their current regimen, and then keep in contact with the doctor. So we knew what the patient was used to having done. We were able to provide the same services for them, just only in a place that was close to home.
Do you have a lot of folks who do that?
Yeah, we do. Especially when COVID hit. That was
right.
something that really, it really took off. Patients wanted to stay out here, they wanted to be out here, but they really didn't want to lose contact with their doctor. So we saw a lot of that with the patients, and we were able to provide for it, which was really amazing.
And how does it work specifically? I mean, do they need to set that up ahead of time? I would imagine you can't just pop in and assume care seamlessly transfers, right? There's a process?
Yeah, absolutely. So we've had it happen both ways, where the doctor will call us and talk to us and say, hey, listen, this is my patient is in your area, and we'd like to kind of see if we can work with you to get it set up. And we've also had the patients kind of advocate for themselves and say, hey, I know that you're here, and I'd love to come out here, but I want to make sure that I don't lose contact and touch with my current oncologist or radiation oncologist. So it's communication. We talk to the patients, we'll talk to the doctors. There's just this constant flow of information back and forth, and we will work with everybody to get it set up.
And so there's, you said, communication between the local treating oncologist or other specialists and, let's say, city doctors.
Absolutely, without a doubt, 100%.
And what about transfer of medication, anything like that, if someone's on chemotherapy?
So we will continue the same regimen. So we have a state-of-the-art pharmacy right at the site of the Phillips Family Cancer Center. So we're able to get the same medication and continue the treatment and a continuous treatment of care for the patients.
And what's the reaction you get from folks who are able to do that?
Phenomenal. They are so happy. We're right there in their neighborhood. We're right there in their backyards to be able to just come to us, get the treatments, knowing that they're still really under the care of their current physician, in addition to now the new physician. It's just been absolutely wonderful.
Is that an unusual setup? Like, does that exist elsewhere that you're aware of, or no?
Honestly, I don't know. To
Right.
my knowledge, I've never really seen it happen anywhere else, but I don't know that we have that situation in a lot of other places in the country where people are spending their time like that. If someone is coming out here for a vacation of 2 weeks, you might not necessarily have
Right.
something like that. But people are staying here for an extended period of time, and you can't miss your treatments.
Right. Okay. Interesting. And so what do you think perhaps is, like the top 3 things you want people to know about both centers, the Phillips Family Cancer Center and the Hermanson Breast Center? Like, what do you want to draw people to?
First and foremost, it's an incredible facility, both places, with incredibly talented and loving and wonderful staff, knowledgeable staff. And we want patients to get the best possible treatment and the best, highest quality of care. So we are here. We are here for the patients. We work with the patients to navigate them through the process. We have an amazing wellness program that we can also support the patients with. And it's really important for me to let the patients know that when you come to our hospital or even our cancer center, that we are treating you mind, body, and spirit. We're looking at you globally. We want to make sure that you're getting the pre-care that you need, the treatments that you need, and then to follow through with these patients to make sure that they're following up and doing well.
And how are you doing?
I am doing very, very well, thank you. I'm about 3 years out, and it's been a whirlwind, but honestly, it was the best thing that ever happened to me.
And I just want to ask you again, because I think it's a really unique perspective that you have that a lot of folks in healthcare maybe don't have, that it changed the way you approached your job, right?
Yeah, absolutely, without a doubt. You look at things as, when you're doing your job, you have this one perspective, and to be able to kind of sit on the other side, to be on that couch for the radiation, to sit in the infusion chair, to have those conversations with the doctor while you're on the exam table is very, very different perspective. And so it really afforded me an opportunity to see the gaps, to make sure that we were filling and fulfilling the needs of the patients in their entirety.
If you don't mind sharing, what was one thing maybe that you thought you saw as a patient that perhaps maybe wasn't missed, but was, or not overlooked, but that maybe needed a little, tender loving care on the administrative side?
The navigation through the process. So from my perspective, having the years of experience that I did, I knew what I needed to do to get the treatment. But it was really very glaring to me when I first got the diagnosis that not everybody knows what to do. You get that phone call and you're sitting in your living room and you're saying to yourself, okay, what next?
Your world stops.
You hang up the phone and you go, and now what? So I actually implemented an oncology navigator at the breast center, and she does work also over at the cancer center, so that patients have someone to walk them through that process. It was really something that I felt that was a strong need, because most people don't have the background that you have as a healthcare provider or as an administrator for a hospital, and you don't know what to do, and it scares you, and sometimes people don't do anything, as astounding as that sounds. And so it was really important for me that patients got the care that they needed, whether it was through Stony Brook, Southampton, or through another organization, that I knew that they were following up and they were getting the care that they needed.
And did you notice a difference after implementing that? Because you make a really good point. There are lots of folks, yourself, or even, folks who just have somebody who can make phone calls for them. Sometimes it's days or weeks of making phone calls for cancer, setting up appointments,
knowing who to call, knowing what was needed, answering some of those clinical questions. I've noticed a huge difference. The patients are really thankful for it, and it just serves such a huge need for the community.
Really fantastic. Okay, Laura Borghardt, thank you so much for joining us. Really great information for folks on the East End or coming to visit the East End who have questions about cancer diagnosis or treatment. We're going to have lots more for you when we come back to Your Health Matters. Stay with us. Welcome back to Your Health Matters. We have another fantastic guest joining us right now. We have Jessica Swiatocha. Jessica is the Manager of Wellness Services and Cardiopulmonary Rehabilitation at Stony Brook Southampton Hospital. Thanks, Jessica, for joining us.
Thank you for having me.
What can you tell us about the program, who it's open to, what services may be offered or classes? Tell us everything.
Oh, wow. So we have a couple different programs that we offer in wellness. One of our programs that we've recently launched just prior to COVID actually was our cancer wellness programs. And those are a very robust amount of programs that we've developed in response to a lot of needs throughout the community. So we're offering a bunch of different classes. They range all over the map, from fitness classes to supportive restorative touch classes to educational classes, and a lot more. So we have a lot going on in cancer wellness.
And who are the programs for, and is there a fee associated with them? Who can take the classes?
That's a great question. We offer our programs to anybody currently in treatment, people that are in their survivorship, as well as caregivers, which that is a little bit unique. A lot of the programs out across the country offer services to patients and survivors, but we really wanted to address the need of caregivers too, because caregiver burnout is such an issue, across the nation and with our population, that we wanted to support the caregiver so that in turn the caregiver can provide a more restorative and restful environment for the patient.
Are the programs free, or is there a cost associated with them?
So all of our programs are offered free to anybody that's a patient, a survivor, or a caregiver. So that's a great option for patients to take advantage of some of these programs because there's really no limitation from a cost perspective.
Can you pick a couple of the programs and give us a little more in-depth? Like what are some of the ones that maybe have the highest attendance, let's say?
We have a bunch of different groups, and I notice different people will navigate towards different programs.
Mm-hmm.
So some of our fitness-based programs we offer boxing, we offer Pilates, we offer a strengthening class. So those are some of our popular fitness programs. We offer anything related to restorative touch. So all of our patients coming through our program get a free 3.5-hour massage one-on-one. But in addition to that, we also offer healing circles, which includes acupressure and acupuncture, and those have been very popular. We run those as a series class, so anytime somebody wants to sign up for those pretty much fill up pretty quickly, and we usually offer a second one right away. But those have been very well received. And in addition to that, we offer nutrition workshops and one-on-one nutritional classes. We offer a lymphedema program, which is an excellent program. It's focused on more of a specialized treatment for patients with lymphedema. And I'm sure there's more that I'm forgetting, but those are some of the highlights.
That's okay. I'm going to pick out a couple to go into a little more depth. Boxing sounds fabulous.
Yeah. I think it's a great opportunity for people to kind of like if they just want to kind of punch out anything that any emotional issues that they might be going through. It's a great outlet for patients to kind of, and I shouldn't use the word patients, but it's really individuals.
Right.
So survivors, caregivers, and people in treatment. So if you're having a bad day and you want to kind of express yourself a little bit more, you get into a boxing class and get some jabs in there, and I think that can help a lot for people.
And what information do people need to know before registering? Is there a timeline? You said some of them are done as a series. Do you need to register for all of them at the same time?
So we definitely like to make the program individualized for each person that comes through our program. So we encourage everybody to give us a call. We have an amazing coordinator. Her name's Patty, and she'll walk everybody through the whole process. It's important for us to make sure everybody's aware of all the programs that are being offered, because a lot of times people will contact us and say, they want the massage, or they want information on nutrition, or they want to do a fitness class, but they might not know that all these other programs are available to them. So we like to take the time to go through and really individualize what their needs are, and then figure out where they can go from there. If they're currently in treatment, we take care of getting the authorization and the prescription from the doctor, because we do require clearance if they're in treatment. Otherwise, it's just a waiver that they have to sign. But we like to sit with them and go over all the information with them so that they can make an educated decision about what programs they'd like to participate in.
Can you talk a little bit overall wellness, right? It's a word I think a lot of people don't really understand because it's so all-encompassing, especially perhaps if people are currently undergoing treatment. So what does wellness mean, especially, let's say, for somebody going through cancer treatment?
So wellness is a very broad term. In my opinion, it's really offering support to the whole group, including the caregiver, including the individual, and offering support through all stages of treatment. Because people are coming in and they might be coming into the cancer center at Phillips Family Cancer Center, or they might be receiving treatment elsewhere. But if they're in our community, we want to be able to help them and support them through their journey. And I think the term wellness means that we're supporting them through their journey and beyond. And we want to be part of that journey with them for the long term, not just for their treatment, not just while they're in their survivorship, and not just if they're having to care for somebody, but we really want to be with them through all stages. So I think that's a major part of the term wellness when we want to be supportive of all aspects of their health care.
I'm wondering if you see people through the process when they're currently in treatment, perhaps toward the end of their treatment, and then do they come back when they're survivors? Because that's probably exciting for you guys.
So initially, so we started our program, I think I mentioned, we started it right before COVID,
Right.
and we had all of our programs in person, and then we had to shut down.
Right.
So initially, before we had a specialized cancer wellness program, we offered a restorative yoga class as well as a level 1 yoga class, and it was through a grant. It was all cancer survivors. So that's kind of how the program initially started. And they're just an amazing group of individuals, and they really had a lot of camaraderie, and we saw that, and we wanted to expand upon that and grow that within the community. So I think that was the impetus for starting the program. So it really did start with those survivors. So we kind of did it a little bit backwards. We didn't see people initially
right.
from being diagnosed to survivorship.
But you might have had it not been for COVID.
Yes. No, but so we do have individuals that are currently in treatment and are progressing into survivorship, and they've been very happy with the program. It's been very supportive. They've made friends. It's just really nice to see that camaraderie build.
And talk about working in that kind of environment, because it's not easy. Obviously, anything in healthcare is not easy. Dealing with patients undergoing treatment and caregivers and survivors, that's a tough field.
It really is. I mean, we have an amazing team of practitioners and professionals that work with all of these patients. We have our social worker at Phillips Family Cancer Center. She runs the support programs. She's amazing. She links everybody up with any support services that they might need for wellness programs. And even within our cancer wellness team, we have massage therapists, acupuncturists, exercise specialists, nutritionists that all have specialized in cancer treatment in their respective areas. So, for example, we have a physical therapist that works with us to do the lymphedema program. She is a certified lymphedema therapist. Two of our exercise instructors are certified exercise specialists in cancer. So having that additional knowledge, I feel like, is so important and so key to providing our individuals and our survivors, our patients, our caregivers with that extra support that they need. So I'm very proud of our team that we've built and have put out into the community.
Can you talk a little bit more about the lymphedema program, not so much in medical terms, but how the program works for the folks that go to it?
Sure. So that program, we have everybody sign in and register through our coordinator. From there, they have a evaluation with our physical therapist who's certified in lymphedema, and they get measured and they track the progress throughout the program as far as measurements go. As far as lymphedema is an issue with a lot of, unfortunately, not just limited to cancer patients, right. But anybody that might have lymph nodes removed, their circulation and ability to drain fluid from their extremities can build up. So those patients need to be monitored and tracked very closely. So what we offer is it's our lymphedema program. It was an exercise and education program. So in that, we're teaching people, number one, they're doing exercises to help circulate and move the lymph around to reduce the swelling in the extremities, as well as just educating them on prevention, on self-massage. There's various topics. So Dawn and Tracy are two instructors for that class. They're both certified in the area, and they're really amazing. It's been a great class to see grow, and we're hoping to continue growing it as we develop it over the next few months and years.
And how do people find out about it? Obviously, word of mouth. I mean, if people are taking an awesome boxing class or a nutrition class, they tell people about it. So is that how most people find out? Are they referred from the hospital as well, or the centers?
Most of our patients are referred from physicians in the area. A lot of our patients have started to hear from other friends, like, I heard my friend's doing this class and I'd like to find out more information about it. So we like to contact them directly. They can go on the website and see all the programs we have offered, but we do prefer that they call us so that we can tailor the program to meet their needs and really sign them up for the appropriate classes. But yeah, there's a bunch of different ways they can go about signing up. They can still go online, sign up. They can call us, they can look on the website. So we're definitely just trying to get the word out there so everybody in the community knows that we're here to help.
Well, this will definitely help,
Yes.
right? And classes are in person?
So that's a
Okay.
great question. The silver lining that's come out of the pandemic for us is that we're able to reach a lot more people. So we were all virtual. We now have moved to a hybrid model where we offer our classes both in person and virtual. So that's been a unique, learning curve as we try to gear everything towards people at home as well as people that want to be in person. We recently reached out to all our participants just to do a survey. What are you looking for? And we continually do that. So we're always adapting and developing new classes, but we also were asking, do they want to be in person? Do they want to be remote? And it was really mixed. So I think, we're going to stay on the same trajectory of being in a hybrid format. I think we'll probably be doing that for the long term because not only are people limited by not wanting to be out in a group setting due to COVID, but some people don't have transportation.
Right.
Some people have a lot of limitations due to their illness that they just can't get out of the house. So being able to reach these people in their living rooms has been like a really nice silver lining from the whole pandemic.
Yeah, it's a really good point. Hybrid for a lot of people, really seemed to be the way to go. So
yeah, so we're going to continue with that.
Great. Jessica, Swiatocha, thank you so much. Great information, great classes. Definitely check it out, right? If you are currently under treatment or a survivor or any kind of a caretaker. Yes?
Correct.
Thank you so much. That's all we have for today's show. This is Your Health Matters. Thank you so much for joining us.
Funding for Your Health Matters is provided by Stony Brook Southampton Hospital. As part of the Stony Brook Medicine Healthcare System, Stony Brook Southampton Hospital is committed to providing world-class academic-based medical care to our entire East End community.